himself in different specialties. He trained himself in different specialties of medicine in different parts of the world, especially in Bangladesh, India, Ukraine, and UK. He worked as a senior consultant and head of the Department of Medicine at Brownbury Medical College and Hospital. And he worked as an assistant professor at Holy Family Christian Medical College and Hospital. Now he has been working as a senior consultant at Leavitt Hospital. The greatest thing is that he trained more than 15,000 doctors in the world. It's a great pleasure for me to introduce our guest speaker today. And I would like to welcome our honorable guest speaker, the founder, chairman, and the course coordinator of SsAcademy, Dr. Sumanta Kumer Saha, sir. How are
Yeah.
you, sir?
Yes, thank you, Mr. Tariq. Thank you very much for introducing me as well. So that's really great that we are here for sharing some of the experiences regarding the after MRCP Part 2, because the year started. MRCP Part 2 result is already published, and we have seen a lot of candidates passed and lots of candidates also unsuccessful on the other hands. Maybe we are listening the candidates, they are successful, but the unsuccessful candidate story that we are not actually listening. And this is not shared even in the social media, like in the Facebook or maybe in other social medias as well. But even then, yes, the congratulating to all the candidates who have passed for the MRCP Part 2 written. And definitely, this is more than half of the degrees that in your hands, my dear doctors who are already having the MRCP Part 2 in your hands. But yes, I'm feeling sorry actually for the candidates who are unsuccessful right at this moment. But yes, once again, I'm giving the full strength of energies and also inspiring the people's idea. The tips and tricks is that after getting the results back in your hands of the Part 2 written, you can see the breaks of the results in your hands in the different specialties, like in the rheumatology, respiratory system, cardiology, gastroenterology. And after seeing them, you can see that how much percentage actually you already acquired. And after seeing them, that you need to be very focused onto the particular subjects that you are really done worst, and definitely you've done better in other subjects that you need to brush it up. And also the tips and tricks that you need to sit in the immediate time means that you need to sit for the next upcoming time for the Part 2. And the people who are now finished their MRCP Part 2, and definitely this is your time to enjoy. This is your really, and you made it, and make it in reality that you have this MRCP Part 2 in your hands. This is such a prestigious degree, all over the world nowadays. Definitely, it will give you the specialist pathway to train yourself to be a more and more good physicians in the future. And on the other hand, that in the international field, that you are becoming a member of Royal College of Physicians of United Kingdom. So that means really a lot. So I have come forward actually to share with you some of the experiences, also along with some of the important tips and tricks immediately after the Part 2 written. MRCP Part 2 written, what are the preparations that you need to do for the further career progressions, like to complete your dream of degree, like the MRCP fully in your hands, means the third part, the critical part, the PACES exam. So thank you, Tariq, thank you very much. Yes.
Thank you, sir. Sir, we have 4 fellow doctors already been joined with us. They will ask you to get to know regarding the PACES preparation. So they have a couple of queries. Everyone have a couple of queries. So can I start the questionnaire session now, sir?
Yes, we can start. Yes.
So I'm going to start the questionnaire session. I'll come to Dr. Dr. F. Rove. Could you please start your question? So before starting the question, then you can start by your name.
Hello, sir.
And then mention your
Hello,
place.
sir.
Where are you from?
Good afternoon.
Good afternoon, Dr. Rove.
Yes, sir. So actually, I'm Dr. Rove. I passed my MBBS from SsAcademy Medical College. So I have actually 2 queries, sir. First of all, I have completed my MRCP UK Part-2 in this July. So how can I prepare for the exam? I mean, PACES exam. And secondly, right now I'm working in Saudi Arabia. So from where can I sit for the PACES exam?
So the first question is how you'll prepare for the PACES exam.
Right. Right.
And second question is, once again?
Actually, I'm working in Saudi Arabia. So from where can I sit for the PACES exam? I mean, from which exam center?
All right. So let me start by giving some important information regarding the PACES preparations. So my dear, listen very carefully. The doctors are here. May I request to Mr. Tariq, could you please just introduce everyone? The doctors are here from the different countries. Or please introduce first, so that I can talk to them.
Yeah,
And I
so
feel
Dr.
that.
Ayaf Rao, he's from Bangladesh, and Dr. Lamisa is also she's also from Bangladesh. Dr. Maul Islam is from Bangladesh, and Dr. Ganesh Acharya is from India.
All right. So yes, dear doctors, and also through you peoples, the peoples are looking at the Facebook. So I'd like to give some of the important information regarding the PACES preparations. But before starting that, I'd like to talk the PACES is a practical assessment of clinical examination skills. Means the PACES, the means really, what does it really mean? It means that practical assessment. What does this practical assessment of clinical examination skills? So this word itself means that you need to be very sharp enough. You have to be very smart enough and sleek enough in your clinical things, including your history taking, clinical examinations at bedside, also manage the patient's concerns, and also having a good communication skills altogether. And after that, of course, the explaining the diagnosis to the patients and your medicine plan altogether. So there are a lot of things actually in day-to-day practice in a clinical side, that in the hospitals, in the outpatient departments, in the inpatient departments, in the acute A&E department, the acute medical intake as well. So how we do practice actually. So these are the things actually that you need to face in the examinations like the PACES exam. It does mean that after the MRCP, actually, in UK, the doctors will be placed in a SPR post, especially. SPR means the specialist register. The specialist register is a mid-level job or mid-level doctor that you need to take the responsibility from the junior doctors in the hospitals, or maybe from the GPs are referral to you, so that you need to read the scenarios and also you need to examine the patients, you need to take the history. So you need to make the diagnosis immediately after that within a very short period of time. So this PACES exam actually designed in that way. If a candidate passes this exam, it does mean that he or she is suitable or suited for that particular position to do work, or can be able to do work in that particular position like the SPR post. Are you getting me, Dr. Rowe, what I'm saying? Dr. Rowe.
Dr. Rowe, can you hear me now?
So it will be fine that if you can do some of the interactive sessions, so that will be really helpful. Dr. Rowe.
Dr. Rowe.
Hello.
Are you getting me what I'm saying? Are you getting
Yes,
me?
sir. Yes, sir. I have got your answer and it's really helpful for me. So I'm really grateful to you, sir. But I have two more questions.
All right, I'm coming back. I have not finished my first questions and answers. Just give me some time, okay?
Okay, sir. Sure.
All right. So I'm using the whiteboard as well, so that you people can understand actually what does it really mean. What I'm saying, my dear, in some of the video clips or some of the videos of the PACES preparations, I already say that PACES is a different exams, different from the Part 1 and Part 2 written exams, in terms of like the Part 1 and Part 2 written exams. Like the you people are past the Part 1, Part 2, so that's really good job that you've already done to the Part 2 of the PACES exam. But yes, once again, for the Part 1 and Part 2 written preparation, the people prepare in a different ways actually to pass the exam of the Part 1 and Part 2. And definitely in Part 1 and Part 2, what happened when the peoples and the doctors are preparing themselves, they usually try to recall the few informations, the most important informations, for tackle the questions actually, or making the answers correctly with the confidence, but not in a comprehensive manner. What I'm saying that in Part 1 and Part 2, that you need to know the words rather than a sentence, means the main or core information, that you need for passing your exam, like the Part 1 and Part 2. In contrast, the PACES exam, you need a comprehensive manner of knowledge. Means the details knowledge of that particular disease and whatever the conditions that you are discussing. So this is the basic differences in between the PACES and Part 1 and Part 2. So one of the things that I have observed in a career of the 12 years of teaching of the PACES candidates in country and outside the country, that I've seen the people whenever they pass the Part 1 and Part 2 written, and that becomes a more bit of easier than their own expectations. The people are really jumping onto appear for the PACES exam without even adequate, proper, and effective preparations. So I did doctor listen very carefully. The PACES needs a very good preparation. I should say in 3 words, I always say that. There is you need a very good complete preparation. You need a very good complete preparation. And that should be adequate, proper, and effective, I must say. So PACES needs an adequate, proper, and effective. Any exams needed, but yes, the PACES really needed that. And see the statistics in between the passing rate of the Part 1 and Part 2 written is around the 40 to 60%, varies from the countries to countries. In UK, is near about the 60%. In overseas peoples, around the 40% in the Part 1 and Part 2 written. In contrast, the PACES passing rate is around 40% in all over the world. And the passing rate is low. So what I'm saying that the PACES, even though the UK people is having the rate of passing with the 40%, you know, in contrast, you see 40 to 60% in Part 1 and Part 2. It does essentially mean that PACES exam is one of the toughest exams among all the 3 exams that you are facing in your life, like Part 1 and Part 2 and the PACES. Are you getting me what I'm saying?
Yes, sir.
All right. So coming back to once again that you asked about the how you will prepare immediately after the passing the Part 2 for the PACES preparation. So yes, my doctor, listen very careful. The PACES preparation needs definitely the supervised training. Supervised training, that is must. The supervised training means the supervised training that you need to do means you need to train yourself under a guided mentor, and that is must. Means you need a mentor. And definitely the mentor must have the quality, they are training the PACES candidates, especially. Rather than just having the MRCP and they are doing lots of jobs altogether, and sometimes they're helping some of the candidates. Nothing like that. What I'm saying means the mentor should have the quality to train the PACES candidates specifically. Definitely they will do better than any other, whatever the MRCP holders and whoever he or she is, doesn't matter. The matter is the mentor should have the quality to train the PACES candidates, the PACES preparing candidates. And of course, this is the #1 criteria for the PACES preparation. Means you need to train yourself, prepare yourself under a supervised mentor. And if it is possible that you need to attach with a hospital, and that if it is possible that in a medical college hospitals, means in training hospitals, rather than a corporate hospitals. If you attach with the one of the hospitals, what will be the benefits? Definitely you will prepare yourself under a guided mentor, but along with that, additively, the benefits you'll get if you are attached with a hospital, the benefit is that you will get much more confident to prepare yourself for the best possible way. Whatever you learn from there, from the mentor, under guided supervised training, you can apply in your hospitals, and you can see the different cases, having a chances to see the cases and deal with the cases and how the things are progressing, so that you can get the much more confident. So this is the two important basic needs actually needed for preparing yourself. And regarding the books and the materials, you say there are huge number of books, materials are nowadays available for preparing yourself for the PACES exam. But now the question is that you need to choose the best things, the best possible ways, how to prepare yourself under a guided mentor. So yes, so these are the basic things. The supervised training is needed, the mentor, or really training specifically for the PACES candidates. And secondly, that you need to be attached with a hospital or the teaching hospital or the hospitals where the core of the cases are there. The multi-specialty hospitals are really needed. And regarding books and materials, nowadays it's available. Any books are helpful. Any books are helpful, Michael, what I'm saying. Every books are helpful. So these are the core things that you need to prepare yourself for the PACES. And Dr. Rove and also any other doctors are here with me in the Zoom, in the live session, and also the other doctors through the work people. As because if you ask me directly, that what will be the ways of preparing yourself? So definitely that you will be glad to know that we are having the SsAcademy in Bangladesh, and we do train the peoples, and this is the only institutions in the country like Bangladesh who started this career to train the peoples for the MRCP candidates, for the Part 1, for the Part 2 written, and for the PACES exam is around more equal 12 years altogether. So this is 12 years of journey. This SsAcademy has already trained thousands of the doctors in country and outside the country for the PACES as well as the MRCP Part 1 and Part 2 written. And it will be great to know that there are a huge number of the doctors nowadays working in NHS with their pride, with their position, and with their quality. So this is really important, my dear. Knowing the facts, if you directly ask me directly, sir, how can I prepare the best possible way? So I should say that you must attach with the SsAcademy. And definitely there are huge number of the courses nowadays available in country and also outside the country and in UK and the different countries as well. A lot of people are trying to help them. Every courses will be helpful. I'm not telling that this course is best and that course is better, nothing like that. Every courses will be helpful. Because the people pass their MRCP or PACES and they know definitely better than that. But the thing is that having such a long careers of definitely SsAcademy and definitely me as well, I'm training. I've been training for a long period of time for the PACES candidates. And I'm working on it 24/7 and the full team behind it. We worked all together to help the people, to let the people to know the best possible way how to pass and how to prepare them the best possible way. So definitely, I must tell you that you should have an experience to train yourself under a mentor. Definitely in the SsAcademy. So there's a way that's it. And second question that you asked about, as because you are in Saudi Arabia now, right? This one. What do you say? Could you please
yes, sir.
ask me the second question?
Actually, I said right now I'm working in Saudi Arabia. So from where can I see it for the PACES exam? Actually, which center I have to choose?
All right. So yes, regarding the centers, I must tell that there are a huge number of the centers nowadays in country and outside the country. Means not in Bangladesh, means the Bangladeshi people is having the centers in India is the first choice. And India has already got more equal 6 centers altogether, including Kolkata, Delhi, Mumbai, then the Bangalore, then the Kochi, then also the Kerala. So there are so many centers nowadays in India. And regarding Saudi Arabia, so what I'm saying for the Bangladeshi people is they should choose the India center. whatever the centers might be, the first. And second, maybe the different countries. Yes, the Sri Lanka is a very good option for the Bangladeshi doctors. And for the third, then you can go to other countries as well, like Malaysia, and then you can go to Egypt. Some people are going to the Egypt as well. Yes, they also having some of the good feedbacks on Egypt centers. So actually, centers are not that vary from center to center. But what is my advice? That you must prepare yourself the best possible way, whatever the centers. Even in UK, if you go to UK, if you're a good, competent, and confident candidate, you definitely have the chances of passing more than 100% cases. So every candidate should prepare themselves the best possible way. Whatever the centers, then I will be there and I'll pass them. Are you getting me, Dr. Rolf?
Yes, sir. Actually, it's a very helpful information for me. So I'm asking actually 2 more questions, if you answer me.
All right, it's okay.
Actually, what are the PACES marking criteria? I want to know that. And what next after passing PACES exam? These 2 are my questions.
So your third question is the PACES marking
Criteria, right?
All right. And fourth question, what do you say?
I just asked what next after passing PACES exam?
Oh, after PACES. All right, I got it. All right, thank you, Dr. Rolf. Yes. So PACES marking, minor. I'd like to tell in a very short form, the passing the PACES needs the 2 criteria you need to fulfill. Means like in part 1 and part 2 written that you have seen that you need to score like the 5 for the part 1 nowadays is how much, Tarek? Do you know about it? It's part 1 like 520.
594.
No. I'm asking about the passing marks, the 525. 540 now.
540.
It was earlier the 521, so they are making more. For the part 2 written, it was 460, something like that. I got it. Something like that.
Something like
whatever.
that, yeah.
490 or something like that, whatever. So I'm just giving a question mark here. So it's from the DIC to NIC as well. So I'm talking about the PACES marking criteria. It's very much important. Here that if you score more than 540, you will pass the single criteria. Similarly here, if you get the more than 490 or 500, so you will pass. But in PACES, there's the total marking is the 172. Total marking. Out of 172, you need to score 132. This is not only the single criteria. Along with that, you need to score and you need to pass the 7 skills, A, B, C, D, E, F, G, the 7 skills separately that you need to pass. Like the G skills is present in every stations in PACES exam, like 32 marks in total. Out of 32 that you need to score at least the 28. So similarly, every skills having the total marks and the minimal marks that you need to score to pass the exam separately. Means you need to pass A skills, you need to pass separately B, C, D, E, F, G all together. Means what I'm saying, in total 132 you must score. Along with that, you need to pass in every skill separately. Are you getting me what I'm saying?
Yes, sir.
That's why that also makes sometimes the people to fail. Even though people score 150 out of 172, but in G skills, they got 27, 32. So this means the fail. Because the minimum criteria is a 28 out of 32 you need to score in G skills. Now the question that you can ask me, what are the skills of what you're saying, sir? So in PACES exam, there is a station 1, station 2, station 3, station 4, and station 5. Means we'll have the 5 stations that a candidate has to cross over in a clockwise fashion manner. Like a candidate 1 will start from the 1, and after finishing the 1, they will go to the 2, then 3, then 4, then 5, then finish. So this is the total exams. So let me give a little bit idea. In station 1, we'll have the 2 cases, the abdomen and respiratory. And station 3 will have the cases cardiology and nervous system, with the neurology. Means station 1 and 3 basically is an examination station. And there will be the fixed 1 case from the abdomen, 1 case from the respiratory system. And the station 3 will have the 2 another cases for the cardiology and neurology. Means station 1 and 3 is an examination station, where you will be allowed to examine the patient only. You are not allowed to talk to the patients. Are you getting what I'm saying? In contrast, station 2 and 4 will be the talking station. Means you are allowed to only to talk to the patients. You are not allowed to talk, examine the patients. Station 2, we call it the history taking, and station 4 we call the communication skills. So once again, station 1 and 3 is an exam station. Station 2 and 4 is in history and communication, means the talking stations. In contrast, the station 5 will have another 2 cases. We call it the BCC1, BCC2, means the brief clinical consultation 1, brief clinical consultation 2. It does essentially mean that you will have the 1, 2, 3, 4, 5, 6, 7, 8, means the 8 cases. We call it the 8 encounters. Means total 8 encounters you need to face as a candidate. Means the 8 patients that you need to deal with in a nutshell. So in this each and every station is each and every cases that the A, B, C, D, E, F, G, the 7 skills are assessed. I call it the A for examination skills. B for binds, binds means the science matter, means the clinical science. C for clinical communication. And D for diagnosis, means the differential diagnosis. I say the E for judgment, means the judgment. And F for, I say the concerns, means the concerns. And G for welfare, means I call it the welfare. It does mean these 7 skills are assessed. What is that? Once again, A skills for examination skills, means examination. B for science, means the critical science, I call it the binds. And the communication, diagnosis, and judgment. So examination skills means examination method, my dear. And the science means the correct critical science that you need to pick it up. And communications means that in station 2 and station 4 and the station 5, these communication skills are there. And the differential diagnosis, especially the station 1, station 2, station 3, and station 5. Judgment means the investigations and management. And FONSAS means, I say the CONSAS, means the CONSAS management, and welfare means the welfare. So I put the ABCD mnemonics so that you can remember all them together. So these are the skills basically are assessed here. I'm not going to the details of the marking system here. Rather than having an overall idea, whenever you go to a course like if you do the course here in SsAcademy, we have the PACES course. We call the SS PACES the online course. Wherever you are, whatever you are doing at home, that you can do the course like that. So you can go through the details of the marking system, because knowing the marking system is really important. If you don't know the marking system, so how can you fulfill the criteria or getting the satisfactory marks and to get the pass marks in relative? So what I'm saying in a nutshell, I should say the PACES exam is nothing but a casting professionalism. you need to understand what I'm saying. Casting professionalism, what does it really mean? I say the casting. C for correct minded. A for appropriate. Just follow me. S for systematic. And T for thorough and fluent. And last is a professionalism. Means, my dear, the skills that are assessed in the ABCD skills means, let me start with the examination skills. Means whatever you do, my dear, that should be correct. So you need to know the correct method of examinations. Similarly, that should be appropriate. Means all correct things are not appropriate. Like similarly, I sometimes used to say, all beautiful words are truth, but all truth words are not beautiful. Are you getting me what I'm saying?
Yes, sir.
This is important. We need to know in a lifeline as well. All beautiful words are truth, but all truth are not beautiful. Understand? Similarly, all correct things are not appropriate, but all appropriate things are correct. Like I've given examples. If the patient having the weakness in the leg, like the patient is unable to raise the right leg off the bed by himself. So if you do the heel shin test, this is inappropriate. So you need to know that what is appropriate and what is inappropriate. So that is what I'm saying, Myra. You need to learn the best possible in each and every steps. What is correct, what is appropriate, what is systematic. Systematic means the format, the standard formats that you need to follow. Like in history technique, there is start with the history of presenting complaint, then go for the other differential diagnosis, and also after the drug history. There are formats, good standard formats are there. You need to follow them. And thorough and fluent, this is very much important. Thorough and fluent. This is nothing like that you're feeling hesitant. I mean, you're stuck somewhere for a few seconds and you are not fluent enough. So you need to have this quality to have the thorough and fluent manner. And last, but not the least, that is a professionalism. Professionalism, what does it mean? Whenever you enter to see a doctor in a clinic, so you need to see that, yes, this man or this doctor is really a confident doctor. That is the professionalism. And professionalism is only will come after having many times that you have seen or you have done the similar things. Are you getting me what I'm saying, everyone? Dr. Rolf?
Yes, sir.
The professionalism means that you need to do the similar things in many times. I mean, you have seen the acute cases of acute severe life-threatening bronchial asthma to manage yourself, or you know actually how to do that. Not only knowing the facts, rather than you know and you already dealt it many times. It does mean the professionalism. So what is the talk minor that I have come forward means that these skills only you can acquire only after doing the practice and practice many times. But you need to know how to do that. And that's why I need a supervised training manager under guidance of the mentor who are really specialists to train the PACES candidates. So this is your third questions and answer, Dr. Rolf.
It was my third question, but
yes.
Yes.
And you asked about the after PACES.
Yes, sir. Yes.
But what after PACES? Yes, my dear. After PACES, everything is yours. Before PACES, the world is playing with you. And after PACES, you will play with the world. Are you getting what I'm saying? Means
Yes,
after PACES, that the degree will come, the full MRCP UK in your name, post nominal, and get the degree. And after that, whatever you want, that you can do, my dear. You can go to UK, you can do their job, you can train yourself, and you can come back once again to your country, and you can, whatever, Saudi Arabia, Singapore, Malaysia, and any other countries. So many countries are recognizing this MRCP UK is a benchmark in the postgraduate qualifications. So having this MRCP UK definitely is a pride for a doctor's. So yes, I should tell everyone here, you're really blessed enough that you already passed your MRCP UK Part-1 and Part-2 written, and that is the journey that you are starting for MRCP UK PACES exam. So thank you, Dr. Rof, for asking 4 vital questions. Actually, they're really important. I think that so many doctors are watching us and also getting the help and getting the important information from here.
Thank you so much, sir. Thank you so much. Thank you so much.
Thank you, Dr. Rof. Now I'll come to Dr. Monul Islam. He's from Bangladesh. He will have a couple of queries. Dr. Monul. Dr. Monul, can you hear me now? Okay, I'll come to Dr. Lamisa now.
Thank you, sir.
Dr. Lamisa.
Hello, sir. Can you hear me?
Yes.
Okay.
Dr. Lamisa, yes.
Dr. Lamisa, she's from Bangladesh.
Introduce yourself first and then ask the question. Yes.
Sir, I'm from Sarsorimula Medical College. Passing year was 2020. Sir, I am 2012 actually. Sir, I'm interested towards PACES exam. So I have few queries regarding that exam. So first of all, I am curious to know how much time do I need to prepare for PACES exam?
So the preparing. So I hope that you got all the questions that asked by the Dr. Rof.
Yes, sir.
All right. So what is your question once again?
How much time do I need to prepare for PACES exam? The exact amount of time.
Time to prepare. Yes. Time to prepare your PACES exam. So we have given a guidelines in the year of 2009 for the overseas doctors, basically. And I hope that everybody got it. And this is the best guidelines, actually. And this best to you did after the MBBS, either during internship or maybe the post-intern, the 1-year training, maybe the 1-year preparations totally. And means the first year, means the 1 year for the MRCP Part-1, next 1 year for the Part-2 written, and next 1 year for the basic exam. This is the best guideline. This is my experiences in the last 12 years. I've seen so many people are doing so hurry to pass their exams, but it is not happening actually in reality. But if the people are really by their heart to prepare themselves the best possible way, so that should be the appropriate guideline, rather than going to be so hurry or going to be so delayed. So what I'm saying is that very specific questions to time to prepare for the PACES exam. I must tell that it depends on the different people's and varies from the lowest time that the 6 months to 1 year. Yes, I must tell that. It depends on the person to person. Now twice years. So if I'm saying that 6 months, at least the 6 months to 8 months, 8 to 10 months, and 10 to 12 months. So if I'm grading here, the 3 grades. If you're thinking that, or the levels, level 1, level 2, if I'm just dividing the level 2 and level 3 candidate you are, means what I'm saying, my dear. If you feel that you are having enough training in your home country and going through so many clinical cases and supervised with some doctors or of your SARs or maybe supervisors, or you've gone through so many cases and you're experienced enough. And I have so many doctors already from Bangladesh. They have the FCPS, they have the MDs in the different specialties. So these people's, for them actually, for the experienced peoples, what I'm saying, the experienced peoples, already trained enough for their, some of the degrees, like some diploma degrees as well, and they have the long-term training in different hospitals. So they should prepare themselves like this, like the 6 to 8 months. And if the people is less experienced here, so they should extend more 2 months or 2 to 4 months, 8 to 10 months. And for the fresh graduates, like they already passed in Part 1, Part 2, even in 1.5 years, within a very short time, even after MBBS, yes, these people need really an extensive training, and definitely the supervised in a teaching hospitals and going to the different cases, like at least that 10 to 12 months altogether. So this time is very structured and very messed up with the candidates. And if you feel that I'm the fresh, then you need to take like the 10, 12 months. You feel that you are experienced enough, then you need to go through the 6 to 8 months. And if you feel that, no, I'm in between, so yes, you can go through that 8 to 10 months. So these are the time frame basically before moving for the PACES exam. I hope that Dr. Lamisa, you got the right answers.
Yes, sir, I got you. Actually, preparation time depends on my level, actually.
Yes. So
I have another question. That is, do I need any specific or requirements of working or training experience before attempting the PACES exam?
Right. So training requirement means a prerequisite you're asking, right?
Yes, sir.
All right. So for the PACES eligibility, if I'm saying the eligibility, it is said to the, according to the Royal College of Physicians, the official website, they say that you need to have the 2 years training after MBBS. Are you getting me what I'm saying? They say that you have the 2 years training after MBBS. So already in Bangladesh, especially in India and also other Southeast Asian zones, the people will have the 1 year internship training. So that is already counted. So you have the 1 year. And now regarding another 1 year, how it comes. So Royal College of Physicians of United Kingdom, they don't demand any specific training certificate, paper certificate. Like you people, whenever you applied for the MRCP Part-1, they only demanded your primary medical qualifications attested by specific bodies, right?
Yes.
But for the PACES exam, they will not demand any paper for your training, that in which institutions that you have done training. But this is said that you need to train yourself the total 2 years after MBBS. So indirectly, it does mean that as because they are not demanding any certificates from you, wherever you are doing training or wherever you are working, doesn't matter. Are you getting me?
Yes, sir.
In the form that when you fill up the form for the PACES applications, there you will see that they will ask you regarding your training period. Then you need to write down the training. That's it. You don't need to produce the paper. If you say them, they will believe it. Are you getting me? That's it.
Yes, sir, I got you. I don't have to submit any proof for this.
Yes. Very good. Dr. Lamisa.
Thank you, sir. That's all from my side.
All right.
Thank you, Dr. Lamisa. Thank you, sir. Now I'll come to Dr. Ganesh Acharya. He's from India, and he have got a couple of queries to ask you, sir.
Hello, sir. This is Ganesh Acharya from India. I have some questions regarding PACES examination.
All right.
Okay. So my question is that I have completed part 1 last January. Am I eligible to sit for the MRCP PACES?
You passed your part 2 in last July or January.
January, sir.
In last January. Yes, so listen very carefully. Say that immediately after passing the part 1, the Royal College of Physicians, they opened it. You can appear for the part 2 or PACES, whatever the order. It does mean that after passing the part 1, you can appear the PACES, then the part 2, or you can, after the passing the part 1, you appear the part 2, then to the PACES. So you are already eligible to go for the PACES exam.
Okay, so in this case, what are the content or format of the MRCP UK PACES exam?
PACES formats, right? As already I discussed, I hope that you got the previous outline of the stations, as I said. As I said that the format is, there will be the 5 stations. Among the 5 stations, the station 1 and station 3 will be the examination station, only examination. And that includes the 4 important systems. In station 1, abdomen, respiratory system. 2 systems, 2 cases will be there. In station 3, cardiology and neurology. 2 another cases will be there. Total 4 cases. You only will be allowed to examine the patient. You will not be allowed to talk to the patient. Are you getting me what I'm saying?
Yes, sir.
Yes. In contrast, the station 2 and 4 is a talking station. It means you will be allowed to talk to the patients rather than you cannot, or rather than examine the patient's side. Means you will be allowed to talk to the patient, and that is the station 2 is the history taking, and station 4 is the communication skills. And other than the station 1, 2, 3, and 4, the station 5 is a BCC, is a brief clinical consultation. And there will be the 2 cases, BCC 1 and BCC 2. Usually in BCC 1, the cases coming are from the rheumatology and BCC 2 from endocrinology. And I can give in good headings, the rheumatology and endocrinology. And maybe other specialties as well. Nowadays, they are giving the acute medicine cases. And the BCC2, they're giving the other cases from like dermatology, sometimes ophthalmology, and that's it. So this is the formats basically of the PACES carousels that I already have discussed. And these 5 stations, actually the examiners are marking on based on the 7 important skills altogether. I can show you some of the marking. The station 1 will have the 2 cases like the abdomen and respiratory. In abdomen, the marking will be the 10, one examiner, another examiner will have the 10 marking. So total 20. Similarly, respiratory 20. Station 3, cardiology and neurology, similarly 20 and 20. So the total 4 cases will be the 80 marks in total. Got it? In the station 1 and station 3, the examination station, the total marks is 80 marks.
Yes, sir.
Next is the history. History is similar, more 20 marks. So total 100. And the BCC case means the station 5. The 2 cases will be there. So 28 plus 28. So total 56 marks in BCC. And last is the station 4. There is only 16 marks. So this is 156, 662, 72, 172 in total marks. So now listen very carefully. I'm giving the one of the important tips and tricks. for all the candidates all over the world. Out of 172 marks, the highest mark carries basically the station 5. This is the station 5, 56 marks. So out of 172, the 56 marks is the station 5. So that's why the most important, the tips and tricks that you need to prepare the best possible with the station 5 to get the full marks of the 56. So I'm giving once again to focus on the 1 and 3. If you prepare the 1, 3, and 5, I'm saying. So 1 and 3 is an 80 marks and 5 is a 56. So how much? 136. So done, pass. Now the station 2 and 4 is the talking station. Sometimes the candidates for the overseas candidates, people are not actually not that expert like the English people are expert in their English language because the exam is in English. So the people are frightened sometimes to deal with the station 2 and station 4 because it's a talking station. Skills and altogether. So this is only carries the 20 plus 16 is the 36 marks. So for all the overseas candidates, what I'm advising, always be prepared the best possible way for the 1, 3, and 5 station rather than the 2 and 4 stations. You will prepare them very well, but don't need to take too much pressure regarding the 2 and 4. Sometimes I have seen in my career of teaching the PACES candidates, the people are not good at speaking in English. They're frightened enough to deal with these stations like it. So for them or for you as well as an expert in English speaker, so whatever might be focused onto the station 1, station 3, and station 5 to get the 136 to get the pass my dear. And I hope and believe you prepared the 1, 3, and 5 very well. Essentially in station 2 and 4, at least you'll get 20 or 10 marks, so 146, 156 marks. So easily you can pass the exam, my dear. Are you getting me what I'm saying?
I got it.
Dr. College.
Thank you, sir. I got it. I got the matter properly.
So any other questions that you may have?
No, sir. That's all for today. Thanks a lot. Thanks a lot for your support. And
Thank you, Dr. Ganesh. Now I will come back to Dr. Monirul Islam. I didn't get him last time because of poor network. Dr. Monir, can you hear me now?
Yes, sir.
Please ask your query.
Good evening, sir. স্যার আমি ডক্টর মনিরুল ইসলাম শেরেবাংলা মেডিকেল কলেজ থেকে 2011-তে এমবিবিএস কমপ্লিট করেছি। এখন আমি বিসিএস পোস্টিং এ পটুয়াখালীর বাউফলে আছি। তো স্যার আমার প্রশ্নটা ছিল যে এমআরসিপি পার্ট 2 রিটেন আমি কমপ্লিট করেছি 2015-তে, তারপর আমার চাকরিগত কারণে দীর্ঘদিন একটা গ্যাপ আছে। এখন আমার ইয়ারও প্রায় শেষের দিকে, তো আরেক বছর বাকি আছে। এই মুহূর্তে লাস্ট এক বছর আমি কিভাবে প্রিপারেশন নিতে পারি এবং কি করা উচিত স্যার আমার?
All right, so Dr. Monirul, thank you very much for a very good questions. Maybe some of the candidates will have the similar problems actually after passing the part 2, and some people are going to the BCS posting and they are not actually deciding what to do and not preparing themselves for the best possible for the PACES exam. So it happens actually. So don't be depressed, first of all, because you have the 1 year in hands. Sometimes I used to say, if you have the 1 day in your hands, you can win the full world, my dear. So if it is said that 1 day is doable to win the full world, so why not having the 365 days so you can win the 365 worlds in your hands to win them? Are you getting me? Dr. Monir.
Yes, sir.
So what I'm saying, I would love to say in Bangladesh, because you say it in, you're from Bangladesh and also you're in BCS posting. So আমি বলছি যে একদিনে যদি একটা বিশ্বকে জয় করা যায় তাহলে মানে 365 দিন তো 365টা বিশ্বকে জয় করা সম্ভব. So I'm saying that don't be depressed. First, secondly, I don't know what you prepared or how you already acquainted regarding the PACES. So yes, because you are in Bangladesh, I must tell that you come to me that I'll train you, my dear, and I'll make you to pass, first of all. Or even then, if you are not coming to me, so you need to prepare yourself the best possible way. Sometimes because of the COVID-19, or maybe the BCS posted from the away from Dhaka city, that you are not able to avail some of the courses available in Bangladesh and also in Dhaka as well, and as well as also coming to SsAcademy. So it'll be great to know that we have already launched the SS PACES, the PACES online course, my dear. PACES online course. If you would love to see the PACES online course a little bit, I can show you the PACES online course, some of the features of the PACES online course, how this course is helping the lots of candidates in the country nowadays, especially in such a COVID-19 situation. So you can actually attend this and doing this online course as a PACES, staying at the areas that right at this moment the BCS posted. Why are you posted now at this moment in Borishal or where?
পটুয়াখালী বাহুফলে আছে।
Oh, Purwakhali. So wherever you are doesn't matter, because the course is designed in that way. You can yes, train yourself just staying at home and going to all the cases. And this course is designed with the variety of cases, my dear. And seeing them, knowing the facts, and keep in your brains, and try to rehearse them and practice many times. And a lot of candidates are preparing in that way, like at this moment. So yes, Dr. Monirul, what I'm saying that I must tell that, yes, you should join the SS PACES course, such an online course, because this is right at this moment that you can't go anywhere to any other hospitals, and you cannot come to the Dhaka city as well. So, and it's very difficult actually to show the cases in the different hospitals because of the COVID-19, right, in these situations. So doing the online course will be the best possible, and definitely SS PACES will contribute to prepare yourself the best possible way. Dr. Monirul.
ধন্যবাদ স্যার এত সুন্দরভাবে বিস্তারিত বুঝিয়ে বলার জন্য। স্যার আমার আরেকটা প্রশ্ন ছিল আপনার কাছে, যদি আপনার একটু সময় হতো। স্যার আমার প্রশ্নটা ছিল যে আমাদের সিনিয়র অনেক বড় ভাইদের দেখেছি যে কেউ কলকাতা সেন্টার, কেউ চেন্নাই সেন্টার, কেউ ইউকে সেন্টার চুজ করে পেসেস এক্সাম দেওয়ার জন্য। স্যার আমার জানার উদ্দেশ্য আগ্রহ হলো এটা যে এই সেন্টার কি আমার পরীক্ষার ক্ষেত্রে এবং মার্কিং বা স্কোরিং এর ক্ষেত্রে কোনো ভেরিয়েবল আছে কিনা, বা সেক্ষেত্রে কোনো এক্সট্রা সুযোগ সুবিধা আছে কিনা?
Means questionটা আরেকবার।
স্যার সেন্টার চুজ নিয়ে কেউ কলকাতা সেন্টারকে বেশি প্রেফার করে, কেউ আবার ইউকে, কেউ আবার চেন্নাই। তো আমরা বাংলাদেশি ক্যান্ডিডেটরা কোন সেন্টারটাকে বেশি প্রেফার করব এবং কোনটা করলে আমাদের জন্য ভালো হবে?
Dr. Monirul, listen very carefully. Choosing the center is really important for Bangladeshi candidates. I always tell them to go for the India, whatever the center, because nowadays it's also getting difficulties to get the seats as well. Seats are getting low, and also because of the COVID-19, taking the PACES exam is a difficult task. So yes, so I should prefer to go for the India center, whatever the centers are there. So should choose the India, whatever the Kolkata, and everywhere is similar. So if you put it down right, the first is a Kolkata, because very close to you and very high passing rate, I must tell. Yes, number two, then you can go to the Chennai. Chennai is the oldest center, it's a very good center. And other centers are very good, like the Bangalore and Kochi. Yes, you can put it down like the way that in a descending manner. Dr. Monirul.
Thank you, sir.
Choosing the center is sometimes helpful. Yes.
স্যার আরেকটু বিষয় ছিল যে আমরা যতটুকু জানি পেসেস এর জন্য ক্লিনিক্যাল অ্যাটাচমেন্ট খুবই দরকার। তো এই কোভিড সিচুয়েশনে তো কোথাও ক্লিনিক্যাল অ্যাটাচমেন্টে থাকতে পারছি না। আর যেহেতু আমরা যারা পেরিফেরিতে আছি, রিমোট এরিয়াতে, সেক্ষেত্রে আমাদের ক্লিনিক্যাল অ্যাটাচমেন্ট থাকাটা বা বেডসাইড যে এক্সামিনেশন, সেই জিনিসগুলো আমাদের জন্য খুব ডিফিকাল্ট হয়ে যায়। বাট পেসেস পরীক্ষার জন্য এটা খুবই গুরুত্বপূর্ণ বিষয়, যেটা কিনা আপনি আগেও এক্সপ্লেইন করে গিয়েছেন। সেক্ষেত্রে আমার হাতে সময়ও কম। আমি কি স্যার, যদি আপনি যে অনলাইন কোর্সের কথা বলেছেন SsAcademy তে পেসেস অনলাইনের কোর্স, সেই অনলাইন কোর্সটা করলে কি ক্লিনিক্যাল অ্যাটাচমেন্টের সেই বিষয়গুলো আমার পুরোপুরিভাবে বোঝা যাবে স্যার?
Yes, I'm actually prompting your questions. Maybe some of the overseas candidates are here. The question is actually is because you are staying at the remote area right this moment. So how these SS PACES or PACES online course, if you do this course, how it will be helpful and also to cover up some of the critical things at the bedside learning. So will it be really sufficient enough to prepare yourself? Isn't it, right, Dr. Monero?
জি স্যার।
The answer is yes. Definitely the SS PACES, the PACES online course, definitely. The answer is yes. This is more than sufficient to prepare yourself. Staying at home right at this moment, during these COVID situations, not going to the hospitals, stay at home, staying at home, and be healthy and safe at home, and preparing yourself the best possible way. SS PACES definitely will contribute to prepare yourself to be a good, competent, and confident candidate for the PACES exam. Because I'd like to show some of the features of the PACES. Would you love to see them, everyone? Yes?
Yes sir.
Yes, of course.
Yes, everyone. Yes.
All right. I'd like to show what I don't know actually have you gone through some of the features already in the YouTube that we have these features. So yes, just a minute, I'm showing that. Okay, sometime, yes. So the SS PACES course basically designed in that way. Actually, if you go through all the stations are covered up here. In the station 1, station 2, station 3, station 4, not only the tips and tricks only. This course is designed in that way to show that every critical science that will encounter in the PACES exam and also in your whole life. So knowing these facts, definitely a lot of candidates will be here and will get the benefits, and you'll be glad to know that already the huge number of the candidates are enjoying this course altogether. The 5. So we have one of the videos already uploaded onto the YouTube and different sites as well as social medias. So it covers actually everything actually what else in the SS PACES and PACES online course. I'd like to have the short overview so that you can have an idea actually what's going on with this PACES course. Yes. Hello, my dear doctors. I'm Dr. Sumanta Kumer Saha, Chairman and Course Coordinator of MRCP UK courses in SsAcademy. I've been training the more than thousands of the doctors in country and outside the country for the membership exams of the Royal College of Physicians of United Kingdom, like the MRCP UK Part-1 for the Part-2 written, and the MRCP PACES exam. That is the third part, the final part, which is the toughest part of the world. You'll be glad to know that a very, very good news for all of you doctors preparing yourself for the MRCP UK PACES exam. The SsAcademy has launched the SS PACES course, a complete online MRCP UK PACES course, which is the most effective, first time in the world, with the materials, the things that you will get, my dear, the best and the best and the best course ever you will experience in your whole life, my dear. In this SS PACES course, you will have the complete package and every materials are there through which that you can train yourself by acquiring this course, by doing this course at home, because this is completely online course and that will give you the every materials. Just if you go through this course, you will learn the medicine, the clinical medicine, the bedside medicine, every possibilities and every material. The question that you asked about the critical medicine and the bedside medicine, and definitely every possibilities are here. And I tried myself the best possible way actually to include each and every possibilities. A candidate really feel inside how to sharp and how to top up themselves to that level actually to give the best from their side to pass their exams.
materials that you need to prepare yourself, to make yourself the best, the confident, and the competent candidate to pass your exam. In this SS PACES course, you'll get the 5 complete stations, my dear. Starting from the station 1, abdomen, respiratory. The 2 encounters will be there. And the station 2 will be the single encounter, history-taking station, my dear. And the station 3, there will be the cardiology and the neurology. And the station 4 will be the single encounter for the communication skills and ethics, my dear. And last, there is the station 5. We call them the brief clinical consultations 1 and brief clinical consultation or skills, the 2 cases, my dear. All together, you'll have the full 5 stations, 8 encounters, and we made the 32 modules, my dear.
So I'd like to stop here, and you can see and watch them. And I'd like to show the course, the details matter, so that you can be understanding actually what's going on in this PACES course. I'd like to share, yes, the screen here. Mr. Tariq and
Yes.
Dr. Monirul, are you seeing them?
Yes, sir.
Yes.
Yes, sir.
Just show how this PACES course. So see that the PACES course here, that whenever the candidates enrolled here, they can start with the induction session. Means that here everything is given: induction classes, marking system, exam format, the presentation skills is one of the important things, like tips and tricks, and how the courses can be followed, and the sample cases are also given here. And starting from the station 1 abdomen, and then station 1 abdomen, we divide the different sections, starting with the introduction session. Here the mark sheet, calibration, everything, and how the things, the abdominal best approach and optimal exercise skills, and everything is given here. And also this course basically is a complete course. Whatever your knowledge level, extent to the knowledge that you have right at this moment, that anybody can start this course like that. Maybe the people are really experienced, highly experienced, or maybe the people are just fresh graduates, just pass the part 1 and part 2. This course is designed for everyone, whoever you are, whatever you are doing, wherever you are, doesn't matter. Matter is the course is designed in that way, in such an unique way. And you should, I must tell actually, this is the best product from my side actually. I opened my heart and I tried my best with a full team behind SsAcademy all together. They worked hard a lot and still they are working. And still the working is going on and will be go on, because this is a continuous development as well also is going on. So definitely this course will contribute to different. You see the different case abdominal, you start the alcoholic liver disease, HCV, hepatitis B, amiodarone induced liver disease, hereditary hemochromatosis, autoimmune hepatitis, PVC, PSC, all the possible cases encountered in the PACES exam, everything is given here, including some of the board lectures that you need to know some of the knowledge is mine. Sometimes the PACES candidates are felt actually what to study now is because I just passed the part 1 and part 2. I know some of the knowledge of that particular disease, but so many actually what I should know actually to prepare myself for the PACES exam to be a good, competent and competent. That's why this course is, you see that then the renal abdomen in such a unique way, the different things and different tips and tricks before handling your patient, that you can actually anticipate what will be the likely diagnosis in this patient, so that you can be able to make the diagnosis and give the presentations confidently. Similarly, the CKD, diabetes, ESRD, renal transplant, so many cases, L4 syndrome, so many varieties of cases, the spleen abdomen, you see the Felty syndrome, chronic myeloid leukemia, hereditary spherocytosis, hepatosplenomegaly, ankylosing spondylitis, amyloidosis, so many cases, the colon abdomen, Crohn's disease, so many cases like that. Similar the respiratory abdomen, that you can see, you can watch and go through that. You see the station 2 history taking. Station 2 is also divided in the different systems. You see the cardiology, neurology, and then rheumatology and the endocrine and so on. The full preparations might be. And the cardiovascular system, once again, the station 3, then the posterior valves, you see the station 3, and then station 3, neurology, the variety of cases are given, and the approaches might be. These are really important. And after that, you see the station 4, the communication skills and ethics, the many cases discussed here, and many cases, the simulated cases are given for your preparations. And also after that, the last case, that the station 5, the BCC market, brief clinical consultation, and this is designed the acute medicine, rheumatology, ophthalmology, endocrine, dermatology, and so many things. And also we have given one carousels and different carousels for the PACES mock exam online. And is a different ways and types of getting some online experiences of the giving a mock test as well at the end of the course material. So I believe in that way that doing this course material, definitely after doing this course, a good candidate will prepare themselves the best possible. Sometimes it happens that people are thinking that doing this course now, you need to go to the different hospitals, specialty hospitals, and handling these patients, my dear. And among your colleagues, those are preparing yourself, like you are in India right at this moment. So you've done the course for the PACES course. So now what you need to do, you need to go to the different hospitals, like for the cardiology cases, for the neurology cases, for the respiratory cases. Then you do discuss among yourself, and these will be helpful to prepare yourself the best possible. Because of the COVID-19 right at this moment, you cannot go to the different hospitals. So what is the tips and tricks now at this moment, that we just go through this full course and writing down all the notes, the SS boxes, SS tips and tricks, and the top tips all together, and go through them many times and do practice with in front of the mirror, whenever you're not getting anybody else, then in front of the mirror with yourself. And you can record your own voices, you can record your own videos, and you can watch them, and you can see, and you can assess yourself, because you are the best you are the best actually tester, or you can say the assessment that you can do from your side. And you can improve your skills by seeing them and by listening them. So these are the ways actually you can improve your skills also. So I must tell them the PACES course is designed in that way. So definitely we'll have the contributions to prepare yourself the best possible. So thank you, Dr. Monero. Thank you once again for the very good question that you asked.
Thank you, sir. Thank you so much.
All right.
Is there anything else to know, the doctors? Dr. Bonesh, Dr. Lamisa, can you hear me?
No, sir. I got my answer properly.
No, sir, I got my answer properly, and I'm helpful, and thanks to sir for giving me the proper answer.
Thank you so much, sir. Thank you so much.
I was joined with us, Dr. Bonet. He joined with us from far away from India. Thank you so much, and thank you all of them, Dr. Lamisa, Dr. Morero, and Dr. Rob. Thank you for being with us, and thank you, our honorable chairman, Dr. Sir.
So yes, thank you very much, Tarek, Mr. Tarek, and also thank you every doctors here, and also with me with the Zoom, and also in the social media, in the Facebook, and also the whoever watching this video. I hope and believe that listening this video and getting some of the important ideas of the PACES exam, and also taking the preparations and what you can do after Part 2 written, and what things really need to prepare yourself the best possible way. I hope that these video clips will be really helpful in your preparations. And even then, if you feel that you need any questions and inquiries, of course, the SsAcademy is always stand beside you to help you, to guide you, to monitor you until the time of your success. I hope that you enjoyed all together. Thank you very much.